Hey everybody, welcome back. This sectional anatomy tutorial is on CT imaging of the abdomen. In this lesson, we'll be looking at the axial plane. In this first slice, we're looking at the most superior end of the abdominal cavity. There's a few important structures that we should be able to recognize right away. First, we'll notice this very large, hard organ in the right upper quadrant. This is obviously the liver. The liver is sometimes larger than people expect it to be, but that is the liver, filling almost the entire right upper quadrant. On the left side of the abdomen, we can see some other important structures. This very bright area here is actually the patient's stomach. This is the stomach in the left upper quadrant, exactly where we would expect the stomach to be. The reason it's bright white is because this patient received oral contrast. It may have been barium, may have been iodine, but either way, it causes the patient's intestinal cavities to light up bright white on CT imaging. A few other structures that we should notice right away. On the posterior border of the patient's abdomen, we can actually see the lung fields. Between the lung fields, on the most posterior side, we can still see the vertebral column of the patient's spine. And anterior to the patient's vertebral body, we can see this round structure here. This is a very important structure that we'll see throughout the patient's abdominal cavity. This is the descending aorta, which supplies arterial blood to the entire abdominal cavity and the lower extremities. One other structure that we can see in the left upper quadrant is this very small area. This is actually the spleen. The spleen is a small organ to start with, and we're just barely seeing a portion of the spleen. As we go more inferior in the patient, we'll see more portions of the spleen. In this next slice, we can still see a significant portion of the patient's liver in the right upper quadrant. Some additional information we can now see in the liver is the portal venous system. The portal vein receives blood from the intestines, it filters that blood, and the blood is circulated up into the heart through the inferior vena cava. We can still see the descending aorta just anterior and slightly to the left of the vertebral body. We can still see that vertebral body. At this stage, we can still see a significant portion of the contrast-filled stomach in the left upper quadrant, and now we can see an increased portion of the patient's spleen, again in the left upper quadrant. As we go slightly inferior in the patient, once again, we still see the patient's large liver in the right upper quadrant. We can still see the portal vein here. We can still see the inferior vena cava. And now there's a new piece of anatomy that we can see inside of the patient's liver, exactly where we'd expect to see it. This is the patient's gallbladder. As we go more inferior in the patient, we'll see larger portions of the gallbladder. We can still see the descending aorta anterior to the patient's spine. We can still see the patient's contrast-filled stomach, and we can still see the spleen in the left upper quadrant. A new piece of anatomy that we can now see that wasn't as visible when we were more superior in the patient's abdomen. We can now see the patient's colon. This particular part of the colon is actually what we sometimes call the splenic flexure. The splenic flexure is where the transverse colon becomes the descending colon, and we call it the splenic flexure because it's associated closely with the spleen. Something else that we can see in this image that we could actually see on the previous two images is these long, slender, muscular structures that cross over the top of the aorta and go behind the abdominal organs. Those structures are called the right and left crus. They're actually appendages of the diaphragm. This next image is very important and gives us a good view of several important structures in the abdomen. We can see just about all of the significant organs inside of the upper abdominal cavity. We can still see the liver here. This entire homogeneous structure is the liver. Inside and closely associated with the liver is the gallbladder here. We can still see a small portion of the portal venous system. We can still see the stomach, which at this point we're seeing the most distal portion, which is now more towards the central abdomen. We can still see the descending aorta. We can still see the vertebral body on the posterior side of the patient's abdominal cavity. We can just barely see a small portion of the spleen. And at this stage, we can still see portions of the colon over here on the left side of the patient's body. Another organ that we can see that we could not see in previous images is the pancreas. The pancreas is a lobular structure that extends from the area of the spleen all the way over to the central abdomen. It does have this characteristic lumpy appearance. It's a long, slender organ, and you'll also notice this blood vessel here, which is closely associated with the pancreas. That's actually the splenic vein, and sometimes we can also see the splenic artery. Two more organs that we can see that I think are easy to identify is these large round structures on the patient's posterior abdominal cavity, and that is the right and the left kidney. In this image, the brightly enhanced portion of the kidneys is the renal cortex, and inside of the renal cortex is the portion that we call the renal medulla. As we go more inferior in the patient, we can see most of these same structures. We still see a portion of the liver. We still see a portion of the gallbladder. We still see the right and the left kidneys. We still see the descending aorta and the abdominal cavity. At this stage, we can actually also see the renal veins from the right as well as the left extending over to the inferior vena cava. We can still see a small portion of the contrast-filled stomach. Don't be confused. Notice that this bright part that's on the posterior side of the patient is simply the contrast in the stomach. The patient is laying on their back, and so we can see air in the anterior side of the stomach. We can still see those kidneys. Something else that we can see at this point that we could not see before is the other side of the colon. This other side of the colon at this point is the area of the hepatic flexure. The hepatic flexure is formed where the ascending colon becomes the transverse colon. And over on the left side of the abdomen, we can still see a portion of the transverse colon here, as well as the descending colon here. Another structure we can see at this point that we could not see before is this large gray area in the central portion of the abdomen. That's actually portions of the small bowel. As we go more inferior in the patient's abdominal cavity, we'll see more of the small bowel. This next image is very good for demonstrating the transverse colon. It's not that common to so clearly see the transverse colon extending across the anterior portion of the patient's abdomen, but in this case we can, so we appreciate that. Something else we can see is the descending colon here and the ascending colon here. Beside the ascending colon, we can still see a small portion of the liver. Of course, we still see the right as well as the left kidneys. We can still see the descending aorta. Remember that the descending aorta is always going to be slightly to the left, and that's an important thing to remember because there's this other round structure in the abdomen next to the aorta, but it's slightly to the right. In this case, it's not enhanced with contrast, but this is the inferior vena cava. So keep in mind that the aorta is going to be the round structure just anterior to the spine, but slightly to the left, and the inferior vena cava also anterior to the spine, but slightly to the right. There's also some important muscles that are very clearly seen here. These are called the erector spinae muscles. They're called the erector spinae muscles because they sit on the posterior side of the spine, and they help a person to stand erect. When you are leaning over and stretch out and erect yourself, the erector spinae muscles are largely responsible for that. This next image includes some of the same information and also some new information. At this stage, the ascending colon is very large, and that's because it actually starts at the cecum. The cecum is a very large saccular structure, which is the beginning of the colon, and we're starting to get close to that area. All of these loops of indiscriminate tissues, this is all portions of the small bowel. And you can see that some portions of the small bowel have been filled with contrast, while other portions of the small bowel have not been filled with contrast. We can still see the descending colon here, and again, this is the ascending colon. We can still see those erector spinae muscles. Something else we can see at this point is another muscle which is associated with the abdominal cavity, and that's called the psoas muscles. These psoas muscles are actually inside of the abdominal cavity. We remember that they're different from the erector spinae because the erector spinae muscles are on the outside, psoas muscles are on the inside. It probably goes without saying, something we haven't mentioned to this point in this lesson is that this anterior structure here is what we call the rectus abdominis muscles. These are your typical abdominal muscles. One more slice that we'll look at, which again shows us some of the same information, but some new information. Notice how we go lower in the abdomen. The anterior portion of the abdomen becomes almost filled with small bowel. Something else that we can see that's very important here is we now actually see 3 round structures on the anterior side of the spine, and that's because the descending abdominal aorta has now bifurcated into the right and the left common iliac arteries. The inferior vena cava also is the result of a convergence of 2 vessels, but we cannot yet see that separation. The psoas muscles are still visible on both sides of the patient's vertebral body. At this stage, we can actually see portions of the pelvic bone. This white area on the left as well as on the right are actually the iliac crests of this patient. We can still see these erector spinae muscles on the right and on the left. And of course, at this point, we can see the ascending colon at the level of the cecum. If this patient had appendicitis, we're very close to the area where the appendix branches off of the ascending colon. We might be able to see that if this patient had a diseased appendix. Thanks for listening. That was an overview of CT abdominal imaging, looking at the abdominal cavity in the axial plane.